we do know that we typically have Alzheimer's 10, sometimes 15 years before we're even diagnosed. So I think that earlier detection, and this goes back to, again, if we start with the very first segment about training the healthcare professionals about what this disease is, being able to ask our doctors or have our doctors ask us, not just about treating the body, but treating the mind. We know loneliness, we know depression, we know all of these factors can become risk factors for Alzheimer's. How do we collectively recognize that and then, again, maybe start some of these drug trials earlier or whatever it is?
And one of the great parts to this story is that if you're decreasing your risk factors for Alzheimer's disease, the secondary benefit, you're decreasing your risk factor for heart disease and all the other major killers in our society. And so I would just urge everyone out there to think about their brain and the brains of your loved ones when we say things like, okay, make sure you're getting adequate exercise. Yes, do eat more fruits and vegetables. It's not because we want you to miss out on all that wonderful fried food and how great it tastes, but it does have an impact.
And I think the other piece of that specific to Alzheimer's is social connection. So I know there was the Women's Health Aging Project out of Australia where they looked at even just babysitting your grandkids once a week was protective because people had better engagement and they were more connected. And so I think in addition to all of those lifestyle measures in terms of cardiovascular health, remembering that social connection, whether it's familial or otherwise, that keeps people better engaged and their brain more sharp.
You got to use that brain.
Yeah, absolutely.
Dr. Murphy, we've talked a little bit about some lifestyle risks. We've talked about clinical trials to prevent Alzheimer's, to treat it. Can we talk just briefly about certain medicines that might increase your risk or exacerbate symptoms of Alzheimer's, such as benzodiazepines?
If you take benzodiazepines and you've heard that taking benzodiazepines can increase your risk of Alzheimer's, one of the important things to know is that you always have to weigh whether the improvement in lowering your risk of Alzheimer's disease outweighs what benefit you're getting from taking the benzodiazepine. And with a lot of drugs like that, I think the problem is that we don't really understand why they increase the risk of Alzheimer's disease. So just for benzodiazepines, as just one example, it could be something like changes in sleep, because we know that changes in sleep or abnormal sleep is really important in Alzheimer's disease, both as a cause and a consequence of Alzheimer's disease. So we don't know how things like taking benzodiazepines and how they affect your sleep, how they also affect your Alzheimer's disease development in your brain. So the problem is very complicated, and I don't really know how this is going to shake out in the future.
We talked about sundowning earlier, and then you combine that with medications. It is very confusing, confounding, and quite frankly, you may think, well, what role is that playing? But we have a benzodiazepine epidemic in many ways in this country, and one we're going to talk about more on this show today. So all of this plays a role, and we have to think about all of these things. But certainly, we don't have enough answers, and that's why we're talking about this here today. Dr. Murphy, thank you so much again for being with us today. Sherry, thank you
for having me
as well. And I think it's worthwhile to talk a little bit more about the benzodiazepine. Can I call it an epidemic?
Yeah, and I mean, I think to your point about Alzheimer's and sundowning, we were just talking about how sometimes when seniors become agitated and they sundown, we throw benzos at them to calm them down.
That is part of the regimen that in their treatment. And maybe we need to reevaluate that.